Hello, I'm Dr. Carlo Carandang, and I'm a psychiatrist. Today, I will talk about the negative cycle of test anxiety. Test anxiety is an anxiety disorder where you have extreme fear, distress, and worry on taking tests. So let's take a look at how test anxiety develops. Here is an example of a negative cycle of test anxiety. So the trigger is taking a test. With this trigger of a test-taking situation, this situation then induces thoughts about the event. So you might think everyone is making fun of me. You may also think they will think I'm stupid. You may also think that you will embarrass yourself, or you might just think that you are going to fail. So these thoughts then induce anxiety, and then you develop feelings such as fear, worry, anxiety, being self-conscious, and you also develop physical symptoms of anxiety from the adrenaline response, which is the flight or fight response which is triggered from anxiety. So the test-taking situation induces thoughts, and then the thoughts induces anxiety. And the anxiety then triggers the release of adrenaline into the bloodstream. So you'll get the physical sensation of anxiety, which includes rapid heartbeat, pounding chest, shortness of breath, breathing really fast, sweaty palms, trembling knees. So these are all the physical sensations of anxiety. So the anxiety then makes you want to avoid. So what you do then is that you might avoid testing situations altogether. But if you do decide to go to take the test, then you will then engage in what's called safety behaviors. So you might avoid eye contact. You might fiddle with your pencil or pen. You might fiddle with your pockets and your personal effects in your pockets. You might keep looking at the clock. You might erase original answers and repeat that. Or you might just plan your escape altogether from the test. However, these avoidant behaviors maintain the belief that people think you are stupid, and it maintains the belief that you might fail the test. So the avoidance then maintains this negative cycle of test anxiety, and it also maintains your self-focus that you will embarrass yourself and that you will fail the test as you will not perform well. So although the avoidant behaviors decrease your anxiety over the short term, the behaviors actually maintain your overall anxiety from the testing situation. So the avoidance then maintains the belief that people are making fun of you, and it also maintains the belief that you will fail the test. And it also maintains your self-focus on you and your thoughts and anxiety. So this vicious negative cycle continues. So the feared stimulus of the testing situation induces thoughts, which then induces anxiety, which then compels you to avoid or to engage in safety behaviors. So instead of just exposing yourself to the testing situation and finding out that nothing bad will occur eventually, you avoid the testing situation or engage in safety behaviors, and this maintains your belief that people are making fun of you or that you will fail that exam. So with avoidance, you never get to find out that the anxiety will just go away naturally if you just stay with your trigger and if you just stay and write your exam. So if you just stay and write your exam, eventually your anxiety goes away naturally on its own. But if you avoid, you never get to find that out. So the solution then is CBT. CBT helps to break the negative cycle of test anxiety by changing how you think and what you do. So it is difficult to change the way you feel, so the focus is on changing the way you think and the way you do things. For more information and help on test anxiety and other anxiety problems, please visit anxietyboss.com. I'm Dr. Carlo Carandang. Thank you for listening.